medical correspondent Dr. John Torres joins us from home, and NBC News contributor Dr. Joseph Fair is with us. He's a virologist and outbreak responder. He was on the front lines of Africa's Ebola crisis. Good morning, gentlemen, to both of you. Before we get into this county-by-county idea, I do want to ask you about the president's remark last night on Fox News. He said, I don't believe you need 40,000 or 30,000 ventilators. You go into major hospitals, sometimes they'll have 2 ventilators, and now all of a sudden they're saying, can we order 30,000 ventilators? Dr. Torres, why would we need so many ventilators? Does the president have a point there?
And that's the plan number one you do when there's any kind of disaster. You make sure you have enough equipment that you can supply the patients that you're going to have. And so we know these patients are cropping up, especially in the hotbed areas, and those ventilators are crucial to keeping people alive. So if you only have 3 or 4 ventilators and you only need 2, but all of a sudden you need 20, well, you're going to be behind the 8 ball at that point. But if you have those supplied already, you can start saving patients' lives right away. And as we talked about, you know, they're already starting to try some different tricks to get those ventilators to work better on different patients. So having that supply is crucially important. If you don't use it, you don't use it, but at least you have access to it.
Yeah, and Dr. Torres, I mean, real quickly, don't these COVID-19 patients on average spend a lot longer on the ventilators than the average patient?
They do. Typically, right. Typically, patients are on a ventilator for a few days, maybe a week or so. These COVID patients are going on there for weeks, 2-3 weeks at a time. And if they're on that ventilator, they're taking that ventilator. You can't use it for any other patient, so you're going to need even more ventilators for the new ones that are coming in. And that's just something you can't predict at this point how many you're going to have. So you're planning for that worst case or even that moderate case scenario.
Okay, Dr. Fair, let's talk about this White House letter. It was to governors suggesting that there could soon be from the federal government county-by-county guidance that would assess the risk of these individual counties as low, high, or medium, and that they could adjust social distancing practices accordingly. Could that work? Would that be effective?
It could only work if you have the data, and the data is based on the testing, and you're still seeing that we don't have the testing everywhere. So if you don't have diagnostic tests in each and every one of these counties and everyone able to get the test, there is no data to support that would work. If there is data, then you could do that. However, that being said, what's going to stop you from going from one county just to the next county, which may be high risk from to low risk? There's no way to enforce that. So I would recommend that the governors ignore these guidelines and stick with their own guidelines that they're doing right now, which is approximately 50% or more of the states are on a commercial shutdown and sticking to only non-essential or essential services, rather.
Dr. Fair, you live in New Orleans. We know that Louisiana is getting hit hard and perhaps going to get hit hard even more so. And when you look at that map that is often put up and it shows New York City obviously is the epicenter with the most cases, is it a tad misleading? Because New York, of course, has more people. But if you start looking at, for example, percentage of cases per capita, where do you start seeing that there are other regions that are experiencing this significantly?
Every major urban hub, so New Orleans, Chicago, Detroit, we're starting to see those as emerging hotspots, and it's not unexpected. You know, the way that we work in this country is we travel to each state. Everybody has family in another state. A lot of people go home to their home areas when they're not working and in times of crises. So you're going to see a lot of transfer between places. And again, without that testing in every place, we're not going to know who has the most cases. We referred to it earlier about Mardi Gras. It was obviously spreading during that time. And, you know, as the individual said earlier, you weren't only passing beads, you were probably passing coronavirus too. So New Orleans is definitely of major concern right now, as are many other cities. And that's going to spread out to the countryside as well, because it's common and natural human behavior that if you're in a major urban city that's undergoing a crisis, you're going to want to get out to your family that may live in the countryside. So we can't call anywhere low risk right now.
Dr. Torres, I mean, we've heard, you know, the stories from the front lines of doctors, particularly in the New York area, about the lack of resources, lack of that personal protective equipment. Is that something that's a problem nationwide?
It seems like it's a problem nationwide, and doctor friends I've talked to in other parts of the country are saying the same thing, that they're hearing that there's a lot of supply, but in their own unique situation, they're having to reuse masks and reuse some of that PPE. And the big concern with them is the fact that, they might get infected. If they do get infected, they could get it to their families, they could pass it on to other patients, or they might not be there to take care of them. They say it's getting better, and it's much better than it was a week ago, but it's still not where they want it at that point where they can use it and they can feel very comfortable being able to use them as much as they need to.
All right, Dr. Fair, Dr. Torres, thank you so much.